An update now on vaccine tourism in the tri-state area, a concept News 12 first told you about last month. It involves people traveling elsewhere for COVID-19 shots because they can't get them in their home state. News 12 Connecticut's Shosh Bedrosian shows us how some of the most vulnerable in our area are doing whatever they can to get vaccinated.
We've been following how healthy people are trying to get the vaccine, but what about people with comorbidities and underlying conditions in Connecticut? Unlike other states, they're excluded from group prioritization. Here's a look at the steps they've had to take to stay healthy.
Connecticut is leaving the most vulnerable like me. It felt like they were just hanging me out to dry.
The Connecticut vaccine rollout was revised several times, initially with plans to give the vaccine to people with underlying conditions by late February and early March.
We're prioritizing those most at risk, those most likely to suffer the worst consequences.
Then taking it away.
All the questions we had about what should be on the list, what should not. Do I need a doctor's note or I just self-identify that I have diabetes?
Connecticut went with an age-based approach, saying it was easier than previous scenarios as they proved the prioritization for other groups to be complex, confusing, and slow down the process. Governor Lamont said 96% of COVID-19 deaths in Connecticut occurred in people over the age of 55 years old.
The overwhelming majority of the folks who suffer complications from a comorbidity are over the age of 55. And they're going to be substantially vaccinated, I'd say, within the next week, 10 days.
Leaving no other option for 25-year-old Stephen Puglisi.
Absolutely.
A Connecticut resident who takes an immunosuppressive drug for Crohn's disease to get it elsewhere.
If I get it, then I could easily end up in the hospital.
Which is why Puglisi took a leave of absence from school when cases increased in November.
I live in the only state here which is not vaccinating pre-existing conditions.
And he's not wrong. Team 12 Investigates went online and found states surrounding Connecticut implement some form of prioritization for people with comorbidities or pre-existing conditions in early group phases.
Rather than sitting around trying to determine whose comorbidity is more severe than others, use your judgment. Make room for those who probably are a little bit more at risk.
Instead, Governor Lamont announced on March 15th anyone 16 years and older can get the vaccine starting April 5th, opening the floodgates to thousands of people, leaving it to hospitals and doctors to decide who to prioritize with hopes of them giving the first dose to those most vulnerable.
I said to myself, no matter what happens, I am not going to wait.
Puglisi couldn't live in a bubble any longer and wait his turn to get the vaccine, so
I Googled how to get a vaccine appointment in Pennsylvania at Rite Aid.
Puglisi drove 4 hours with his mother, crossing state lines and staying overnight in a hotel to Mechanicsburg, Pennsylvania, a non-residency state for the vaccine and places people with underlying conditions in their Phase 1A. That's when he got his first dose of the Pfizer shot.
The minute I left the pharmacy, I basically was crying. It was just such an overwhelming sense of relief. It's really indescribable.
Data from the CDC in June points out that hospitalizations are 6 times higher and deaths 12 times higher for COVID-19 patients with underlying conditions. According to Connecticut Department of Public Health, nearly 362,000 people in Connecticut aged 16 to 64 have one or more comorbidity. That's just over 10% of the population.
Even though we might not be a large population, we exist. And it feels like we don't exist in the eyes of the government, and that's extremely frustrating.
Stephen Puglisi heads back to Mechanicsburg, Pennsylvania for his second dose tomorrow. We're continuing to follow the journeys people in Connecticut are taking to get the vaccine with underlying conditions, and we'll have much more for you tomorrow night. For now, I'm Shosh Bedrosian, News 12.